Hi, Dr. Tracy Tyson. I'm a board certified general pediatrician, and one of the most often questions and concerns I get in clinic with babies is about reflux. So let's talk about infant reflux. What is it? What are some treatments? And when do you need to see your doctor about it? So first of all, it is very normal for infants, especially under the age of 4 months, to spit up. So there's a few different reasons for that. Remember that their diet is completely liquid. They are often laying flat. And so those are two things that set them up for it. But there's also some anatomical reasons for it. So there is a sphincter or a muscle that controls the milk staying in their stomach and not coming back into the esophagus or feeding tube. And that is pretty loosey-goosey in babies under 4 months of age. So it's not super tight. It has to get tighter and stronger as the baby ages. So when you add those three things together, kids spit up a lot. There's also some other factors, such as a baby's stomach when they are first born is really small, like sometimes about the size of a dime, and it slowly gets bigger over time, yet they're hungry. So they also overeat and they fill themselves up to here and then they spit up. So that's another reason for spitting up. But reflux specifically, it's going to show up in a few ways in babies. Sometimes we have what we call a happy spitter. And that is a baby that spits up after feedings. Sometimes it can be quite a lot, but they vomit or spit up after feedings. They're growing well. They're relatively happy. They're done after they spit up. They're not super hungry afterwards, and we kind of just leave those kiddos alone. If the spit up itself bothers you, you can keep them upright a little bit after feedings, making sure they burp really well. Pace their feedings. Don't let them feed too fast at a time. Readdress what kind of bottle or positioning for breastfeeding so that they're swallowing a little bit less air, because sometimes it's the air bubble rising underneath the milk and then the milk comes out. So some of those techniques can help so that they don't spit up quite as much, but otherwise we call this a laundry problem. And that's not to negate how difficult it is. Both my kids were spitters, I get it, but it's not a medical problem and it will get better. Most of them stop it by the age of 4 months. We don't recommend keeping those kids propped up at night. They don't need it. So the other kinds of reflux are the kinds that actually cause medical problems. So sometimes the reflux can be so bad that it can cause severe pain, or what we call erosive esophagitis, where the esophagus is getting burned because of the acid that's coming back up. Sometimes that is hard to tell from colic, but some examples of this would be a baby who's in extreme pain after feeding. They're arching their back, they're stiff, they're crying, they're red-faced, they're absolutely miserable, and none of the other techniques help. It doesn't help to keep them upright. It doesn't help to burp them. It doesn't help to feed them in different techniques. It doesn't help to thicken their feeds a little bit so that it's less likely to come up, and it can happen at any time in between feedings. Those babies should be considered for possible treatment with medication, but not all. But that is a reason to definitely talk to your primary care provider. Another reason would be if they're a failure to thrive. If they're not gaining weight because they can't keep the milk in their stomach because it keeps coming back up, or because they're in so much pain that they don't want to eat. That would definitely be a reason to treat, and or breathing difficulties. So when the reflux comes up, when the milk comes up and it's mixed with stomach acids, it causes irritation around the vocal cords. And in babies who already have narrow vocal cords, it can make this worse and cause them to have difficulty breathing. So those would be the cases where you absolutely want to make sure that you treat. Why wouldn't we treat the other kinds of reflux with medication? And that's because every medication has a side effect. Everything we do has a positive effect and a negative effect. So we always weigh what is the risk of the medication or intervention with the benefit that you would get. And in babies who are just happy spitters, a little bit uncomfortable but growing well, the risk of the medication far outweighs the benefit, because this will get better. Most babies' reflux is gone by 4 months. It can go later, but that's the majority of cases. So putting them on a medication which could have side effects when there's other things that we can do and it may not work that well anyway isn't going to be helpful. So what are some things you can do if your baby is a happy spitter or has some mild pain and issues? What are some things that you can do at home? So first and foremost, if you are breastfeeding, trying to change the position around a little bit. I find sometimes it is a really, really strong letdown in mom, or the baby has not a great latch, and so they're pulling off a lot and getting a lot of air, and that's making it worse. So sometimes you can actually put them on forward and lean back so they don't get as strong of a letdown. changing your technique in general. Sometimes the sideline kind of traditional way of breastfeeding your baby actually increases their risk of reflux. So talk to a lactation consultant, talk to your primary care provider if they have experience with breastfeeding, going over some different techniques to see if the way that you're feeding can help. Another thing is frequent burping. We can't really tell if a breastfed baby is overeating, so you just want to make them pace themselves. Pull them off every few minutes, try to get them to burp, give them a second. That way they don't just kind of fall asleep at the breast and take more than they intended to, because if they overeat, the reflux will get worse. After you're done burping them, sit them upright for a little bit. I used to even just kind of put my kids in a boppy next to me and just kind of let gravity do its job. I also love the technique where you have the baby kind of lying on your arm with their face in between your fingers a little bit at an angle. You just gently rub their back. It can kind of allow, the spit up goes in the opposite direction, but it allows gravity to do its job and puts a little bit of pressure on the tummy. Other things that you can do for breastfeeding babies is to try to change your diet. I find this to be the least helpful, but when I was doing a little bit of reading prior to filming this video, there is some evidence that in some people, getting rid of cow milk protein in the breast milk as well as gluten can sometimes help. So if you're super desperate, you want to avoid medication, as long as you are getting enough nutrients yourself, you can try these. I'm often hesitant to recommend it because I don't find anecdotally that it helps that much, but it's not going to hurt anything as long as you're getting the nutrients. So you can always try some dietary changes and see if it helps. Other things that you can do is to do tummy time a little bit propped up. So having a toy, like a little caterpillar or a boppy pillow underneath their chest so they can do their tummy time, they're less likely to spit up and be fussy. We only recommend sleeping at an angle by your medical provider because that can lead to increased risk of issues with sudden infant death. So we always want to make sure that that is recommended by your provider. And again, we weigh risk versus benefits. Don't ever put your baby in like a wedge. Don't ever put them in something that causes them to do this way, and don't let them sleep in their car seat. Other things you can do if you are bottle feeding, again, change your bottle around, see if they're taking in too much air. Make sure that the nipple is the slowest flow, because we want them to take their milk in slowly. So they don't overeat, they pace themselves, and they don't swallow as much air. You can also thicken the feeds. Again, talk to your primary care provider about this. If you're using breast milk in a bottle, you can use something called human milk fortifier and thickening agents. That way, it's actually a thickening agent, not the fortifier. If you're using formula, you can actually add baby rice cereal or oatmeal to it. Start with 1 teaspoon per ounce. You can go up to 1 tablespoon per ounce. Talk to your provider about what's best for you. But thickening it up just allows it to stay in the stomach a little bit more, and then every time they move, it's less likely to come right back up. Those are appropriate things to try. Again, keeping them upright after feeds, pacing them, making sure that they are burping really well. Those are great techniques to help. If you need to try a medication, first we start with a medication called famotidine. That is first line in the United States. Then we can also move on to other medications which are called PPIs or proton pump inhibitors like omeprazole, Nexium. Those are things that we use as well in babies, and they're prescribed by your primary care provider. Not every baby that has reflux needs to see a gastroenterologist. They only need to see a gastroenterologist or a stomach doctor if we think they need to put a scope down there, or we're on our 3rd medication and we still can't get the symptoms. There is no test for reflux. It's a clinical diagnosis. All of the tests are too invasive. They're not super helpful. And so we only do them if we have to. So I hope this helps. This is a very common thing, but I don't want to also negate how hard this is for families. So if you have a baby that's struggling with pain associated with feeding, and then you add something like colic on top of it, it is really distressing for families. If you are struggling with your mental health over your child with excessive crying, please reach out for some help. I have seen some really horrible outcomes where parents have come in over and over and over again asking for help for something like colic or reflux, and there ended up being a bad outcome because the parents were so overstressed. So please reach out to us. We are here to help. And if there's anything else we can do, let us know. Take care.